Okay. Good evening, everyone. My name is Laura Rangard, and I am one of the co-chairs of the Public Health Advisory Committee. I'd also like you to introduce the other co-chair, Jerome Evans. Would you raise your hand? Thank you. Before we begin, I'd like to note that this meeting includes the remote participation of members as authorized under Minnesota statutes sections 13D.021 due to the declared local health pandemic. I will now call this meeting to order and ask the clerk to call the roll so that we may verify the presence of a quorum.
Sorry, I was laughing. I don't know, that title slide is always just a challenge for me for some reason. I don't know, getting in and out of it and the timing right. So, okay. Terry Ann Jones.
Present.
KJ Starr is excused tonight. Mary Pike.
Present.
Kozar Mohammed. Kozar. Lisa Nikotra.
Present.
Anna Arkin.
Present.
Fatima Jaffer.
Present.
Alicia Jackson.
Present.
Laura Rangard.
Present.
Jerome Evans.
Present.
Andrew Crook.
Here.
Britt Culp.
Present.
Wanda Felder. Wanda. Meredith Martinez is excused tonight. Craig Hedberg excused. Babette Apland excused. Aaron Hurley. Aaron.
I think he said he was going to be late.
Okay. And Jolie Punjabi.
She is having difficulty logging in. So I just resent her the link.
Okay, well, we have 10 people present. That's a quorum.
Great, thank you. With that, we'll proceed to our agenda, a copy of which was posted for public access on the city's legislative information management system, which is available at lims.minneapolisminnesota.gov. Great. With that, could I have a motion for approval of the agenda and minutes?
Motion.
Second.
Who seconded? Was that you, Andrew?
Andrew Crook seconds.
Perfect, thank you.
Are you ready to vote?
Yes, thank you.
Terry Ann Jones.
Yes.
Mary Pike.
Yes.
Kozar, did you join us yet? Lisa.
Approved.
Hannah Arkin.
Yes.
Fatima. I don't hear you.
Approved.
Thank you. Alicia.
Approved.
Laura.
Approve.
Jerome.
Approved.
Andrew.
Approve.
Brett. Was that a yeah, Brett? I'm sorry, I didn't hear you.
Let me? Oh, I
Yeah,
said approve.
thank you. Wanda? Not here yet. Aaron, did you join us yet?
Wanda is not going to be able to make it either.
Okay. Angelie? I thought I saw you come in.
Yes. Approved.
Okay, that motion is carried.
Great. Do we have any guests with us this evening that want to introduce themselves?
Yes, my name is Sharon Horace, and I live in the 8th Ward.
Welcome, Sharon.
My name is Jessica Guzman, and I'm here just observing the meeting for nursing class at Augsburg College, or university now.
Welcome, Jessica.
Thank you.
Right. Well, this evening we've made a slight adjustment in kind of our sequencing to allow ourselves a little bit more time in our work. It sounds like we need to do a little bit of reorganization before we break out, but we wanted to start with an update from our Deputy Commissioner, Noya Woodrich, first thing, so that then we can move into our working sessions. Noya, are you with us?
I am.
Great, thank you.
All right. So we did, there's like 4 things I'm going to give an update on. The first is the hiring of the health equity manager, which last time I was at this meeting, I asked for someone to help with interviews, and we did do interviews. First of all, we had 16 or 17 applicants total, which is not a big number at all. And we interviewed half of the people. So we spent a whole day doing interviews, and at the end of it, there were a couple people that we thought we could advance for a second interview, but nobody felt really strongly about either of those individuals. And so we instead decided to not do second interviews and repost the position and try to find a bigger pool of applicants. Well, because of HR and city rules about hiring, we ran into this challenge of when you post a position in the city, then you have an eligible list, and the eligible list is all of those people that were deemed to have met minimum qualifications for the position. That eligible list can stay active for anywhere from 30 to 90 days. Way at the beginning of this, like back in July, we had said, well, let's leave it active for 90 days. The problem is because we didn't find anyone to hire out of that first process, that meant we wouldn't be able to repost the position until the end of February because that list is still active. So we actually, I actually went to the Civil Service Commission meeting today to ask them to close the list for us early so that we could get the position reposted, because I didn't want to wait until the end of February to repost the position. So they gave us approval to do that today. So hopefully this week we will again get the position posted. We changed, we didn't change anything about the kind of core or intent of the position, but we did add language to the job announcement to make sure that it was really clear what it is we were looking for in terms of experience and skills. And we described a little bit more about what we wanted the position to do, or the person in that position to do. The other thing that we're going to change from last time is HR has hired a recruiter since the last time we posted, and so we will have an additional support in the Human Resources Department to promote and do some engagement and recruitment for the position.
Oh yeah,
Yes.
I'm sorry to interrupt you, but I just beamed people out of this room accidentally.
Okay.
So they missed about the last minute of your speech. And
I
that
saw a
was
bunch
fun.
of flickering
That was
on my
fun.
screen taking place. I was wondering what was going on. Anyhow, we've been given permission to repost the position now instead of at the end of February. HR has a new person that's been hired to help recruit for all city positions, and that's something different than what we didn't have that person last time. So that person will be doing a little bit more intentional work to recruit and engage for this particular position. And then there's some of us in the health department, me, for instance, that are going to do a better job of promoting the position in our networks. So for instance, I did share it on my Facebook page last time, but I didn't share it on LinkedIn. I didn't send it to any people that I personally knew that might be qualified or interested in the position. So I've talked to a few people in the health department and said, when we get this reposted, will you please Facebook it, Instagram it, tweet it, LinkedIn it. Really, we want a bigger applicant pool than 18 people to start with, and we do want people that I think the interview committee has a little bit more confidence in. I will say the good news is the majority of those people that applied were people of color, and of the 8 people that we interviewed, 7 of them were people of color. So that was one hope of mine in posting that position, that we would be able to really find a strong qualified person of color to fill the position. And the fact that we had that many folks of color applying for the job was really, at least made me a little bit hopeful that we'll be able to repeat at least that part of the last recruitment process. So if we are able to get that position posted again within the next 7 days, I anticipate that we will be looking to do interviews around the beginning of December again, with the hope of getting someone on by January 1st. This is about 6 months longer than I wanted it to be, but I also want to make sure that we have the right person. And hopefully reposting it and doing a better job of promoting the position will result in a better outcome for us. Secondly, I guess Gretchen gave an update on the budget last month. We did do, she and I did our budget presentation to City Council a few weeks ago. Nothing earth-shattering happened at that meeting, so now it's just continues to go through its public process, and we don't know, or we won't know any more about that budget until December, when City Council votes on it one way or the other. COVID. I get tired just thinking about it. It's been a long time, and we continue to work towards embedding the COVID work that we are doing into the department. The biggest piece of that, of course, continues to be the vaccination. We continue to have vaccination events. They are smaller in frequency and smaller in attendance, but we continue to work with community partners to provide those opportunities for vaccination. We are working closely with Minneapolis Public Schools to start planning for vaccination of the 5-year-olds and up. We are continuing to do outreach into the community regarding the boost, either the 3rd shot or the booster shot. And we're noticing that there are some subpopulations, like pregnant women, that we're just not seeing vaccine uptake. And so we're continuing to figure out how we can promote this in those communities. As we embed the COVID vaccination work into the health department, we're also adding flu onto that. And then at some point we'll be adding measles immunization onto that. So our immunization and vaccine work will be a little bit broader than it has been in the past in terms of actually getting out there and providing a vaccine or an immunization for folks. We are using some of the COVID grant dollars that we've received. We will be hiring, and I'm also hoping to get those positions posted next week. We will be hiring a immunization and vaccine coordinator. I think I maybe mentioned this last time. That position description finally made its way through all the layers of approval that a new position does. And so I'm hoping to get that posted soon. We're also going to be hiring a community engagement coordinator, and then we will be hiring 3 or 4 community engagement specialists representing our different communities of color here in Minneapolis. So we are actually in the process of hiring someone that represents the East African Somali community, and then we'll look to be hiring someone representative of the African American, Latino, and Southeast Asian community. And then if I'm successful in finding additional funds, we'll hire someone representative of the Native American community. But in terms of vaccine uptake, the Native American community, interestingly, is doing the best. So we want to focus on those other communities first. And we continue to give out PPE. We continue to provide COVID tests to organizations and businesses and individuals throughout the city, though we're not doing testing events like we did last year. And we continue to work on communications. We are right now finishing up getting 5 MOUs or contracts in place with organizations representing our 5 different main cultural groups here in Minneapolis. Those organizations will be working with us over the next 14 months to make sure that the information we get out about COVID is culturally relevant and speaks to the specific needs of our community. So those contracts should be in place by November 1st. And I think that is all I have.
Thank you, Noya.
Questions for Noya?
Noya, did you say in that last part, did you say that we are contracting or continuing contracts with the cultural organizations around communications?
Yeah, so we did have contracts with them, but those expired at the end of July. So we're right now renewing those contracts with them.
Thank you.
And then Mary, you have a question?
I did, Noya. Can you tell us a little bit more about the work you hope to be doing with the Minneapolis Public Schools regarding COVID vaccinations for kids 5? I think it's 5 to 11 now, right? Can you tell us a little more?
Not much more, honestly, because as I get information from my vaccine team, then I have more information to share. But we are, so sometime back, we identified in Minneapolis those zip codes where we have the lowest vaccine uptake rates. And that the reason we do it by zip code is that's how the data is tracked at the state level. So we have 5 or 6 zip codes that, not surprisingly, are in South Minneapolis, just south of downtown, and in North Minneapolis, just north of downtown. And we have said that those are the zip codes that we will continue to prioritize in terms of any of our vaccination work. So when it comes to vaccinating the 5 to 11-year-olds, we're going to be targeting schools that land in those zip codes. And that's about what I have to say about it.
That's helpful. Thank you.
Yep.
Anna, do you have a question for Noya?
Hi, yeah, wondering what the current vaccination rate is in the city.
I can get that to Margaret, and Margaret could send it out. I don't have that off the top of my head.
Great, thank you.
Mm-hmm.
I think the last time that Gretchen reported on that, maybe a couple months ago, we were well over 75% in the city. So that's at least encouraging.
Jerome?
Thank you, Laura, and thank you, Noya. This is related to COVID, but hopefully more of a positive. Over the course of the week, I was thinking about the last time I'd really seen the public give a positive affirmation for the work that our healthcare teams are doing. And I was thinking about different ideas for how we as a committee can maybe recommend to the city that we do something to recognize healthcare staff. And so, my crazy idea at the time was like the bridge. But I'm wondering, Noya, if over this long experience that you've had during the pandemic, if you can think of a time when your work was recognized and it seemed to boost morale with the team, because maybe we can take that as a little seed and turn it into something that we can do for our hardworking healthcare heroes.
I might want to take that question back. I mean, I'll tell you where I am right now. I woke up at 2:45 a.m. this morning to catch a plane from Nashville to Minneapolis. And I was supposed to have the day off, but all of this sudden, this stuff popped up on my calendar. I knew I was going to be here tonight, but I had all this other stuff. And then after a day and a half out of work, I had 180 emails waiting for me. Like, that's just sheer ridiculousness. So I'm not in a good place right now to answer that question with some level of reasonableness. So I would be, it's a little hard for me to think over the last 18 months. Was there a time where I felt like the city appreciated me and the work I was doing, much less all of the other dozens of people around me doing the work? But I think I would be willing to go back and talk to some of the staff that were on the incident management team, like Margaret and many others, and just say, hey, is there anything that the city's done or the health department's done over the last 18 months that made you feel better about the work that you were doing on behalf of COVID? And I don't know that, I need to wait until next month to bring that information back to you. I think I would be willing to ask the question and get the information out to you by way of email or whatever the official avenue is to do that. I do think, I'll be a little honest and say I feel a little stymied sometimes. I mean, the way that I'm used to appreciating people out in non-government world is to buy them a meal or, buy them a little token of appreciation. And those are things we can't do as city employees. And so it has felt a little frustrating. On the positive side, we were able to secure some money from the Minnesota Department of Health. They gave out a pot of money under the umbrella of workforce development. And we carved a nice little chunk of money out of that pot to do some well-being, employee well-being, mental health, well-being type activities with staff. And I have a little group of staff people that I'm meeting with 3 times over the next 3 weeks, and together we're going to plan how to spend that money. So I think there's little things like that are helpful as well. But I can certainly get back to you with some thoughts and ideas as well.
Thank you.
I can add that working in the hospital, the heroes banners get really patronizing because we go to work. We're like, the weird hero thing gets weird. Pizza parties and granola bars aren't exactly what anybody in healthcare is looking for. We're, looking for there to be some semblance of like consistent messaging for public health across the board. And I know that that's been hard in general from a public health standpoint because it is a literal novel virus. So the messaging has always been kind of going back and forth from the beginning, it felt. And so that kind of decreased the trust in the healthcare community. But I think really investing into some sort of pot for at least paying co-pays or helping with paying for mental health support for healthcare staff, because I just started therapy myself and it's a $30 copay every week, which adds up. And, why I'm in therapy is slightly different, but there's a lot of things that are related to what other more frontline, like the medical staff are going through, the floor staff and the boots on the ground out in the community workforce is going through, because we've all had some high levels of burnout, vicarious trauma, and then some direct trauma from the things that we've witnessed.
Thank you, Brett.
Thanks, Brett. Mary, did you have another question, or is your hand just still raised from?
Noya answered my question. I don't know how to unraise my hand. So
I think if you hit it again, it should, there you go. It's down.
Okay, thanks.
Any other questions for Noya? Noya, thank you so much for the update and for all of your work and the works of your teams.
You are welcome. Always glad to come join this group. Have a good discussion.
Thanks.
Oh, yeah.
Right. So our next order of business is to have some breakout time. But prior to calling the meeting to order, it was obvious we had a little bit of confusion into kind of which breakout group is really focused on which core work. So I think we have just a little bit of clarity probably to arrive at before we push folks into rooms. So Margaret, do you want to try to offer some clarity, or Jerome, if you feel confident? I feel not as confident in where we may be having some confusion. So
yeah, I can maybe start if you want, Jerome, and if I go awry, just like raise your hand or wave your arms and you can correct me. But
you're good.
I had the same question because I had offered to join the food, drink, and medicine group, and I thought, I'm not even sure, like, what exactly are they talking about? So I went to that PowerPoint that I had sent out it must have been last week sometime, with the meeting notes, and reviewed the PowerPoint and printed off the pages for food, medicine, and drink. And then I printed them off for environmental and mental health, because I felt like those were the two buckets that I wasn't quite clear on. So I'm going to start with food, drink, and medicine. So the slide that talks about that says it includes access to food and water quality, including intentional and unintentional drug use, including also vaccination concerns. And then when you get further into the slides, it does indicate things like vaccine hesitancy, issues relating to drugs that are not opioids, as well as to opioids. It also includes loneliness and issues relating to isolation and mental health. Loneliness, including issues relating to isolation, mental health, and drug use. It also includes vaccine hesitancy, which I'd already mentioned, sorry, and vaccinations, suggesting policies that motivate people to get vaccinated despite their concerns. The two other things that it includes is access to dentistry and access to healthcare services besides dentistry. So there's a lot in that food, drink, medicine that, yeah, that can be unpacked anyway in conversation. The second group, so currently in that food, drink, and medicine group, initially was Mary, Andrew, Meredith Martinez, who can't be with us tonight. And then Mary, you had offered to, or you had indicated that you wanted to go to environmental and mental health, but let me just tell you a little bit about that group as well. Jerome, am I on track so far? Okay, great.
It's great.
Okay, excellent. So now environment and mental health. That includes climate change, air quality, and safety, which includes a whole bunch of things like speed limits, biker safety, domestic violence, you know, blah, blah, blah. But I will read through more detail. So those areas are, come on, man. Sorry, the paper's not cooperating with me. A lack of mental health service providers for young people. A lack of culturally competent mental health service providers. Sexual exploitation prevention, so prevention of sexual exploitation. And public safety, which was just a giant bucket, and air quality. So in that particular group, I'm not sure I can name them all off the top of my head, but I know Craig Hedberg was in that group. I think Terry Ann Jones was in that group. Aaron Hurley was in that group. And I'm not sure if I'm missing somebody.
That's it.
Yeah.
Okay.
So what I can say as well is that if you haven't chosen a group yet, you can certainly pick any group you want. We just need to let Hattie know which group you want to go to. And then, Hattie, I don't want to like spoil the tech stuff that people need to do when they get into their groups, but I did send out, Hattie created a title slide like you saw tonight when we opened the meeting. And when we go into our breakout rooms, and I guess I will invite our guests to also perhaps voice which breakout group you want to go to, or you could put it in the chat because that would be an appropriate use of the chat to indicate which breakout group you would go to. But I've already sent out the title slides to people in those small groups to make sure that the very first thing is the title slide goes up, because when IT gathers the recording of all of our conversation, they want to make sure that they put the subgroup committee discussions in with the right committee. So that's why it'll say Public Health Advisory Committee, like working group A or number 1 or whatever it is. And so the people that share that title slide, somebody also needs to hit the record button. So now, Hattie, I'm going to look at you and see are those directions correct? And is there any other direction that needs to be given?
I don't think so. Just put up the title slide and then start the recording, give it a beat, and then you can take that title slide or quit sharing your screen and take that title slide down.
Can I just ask, I am not a Teams user. I know Zoom inside and out, but other than logging onto this meeting and mostly listening, I have no idea how to share a screen or record. So could someone just walk us through that quick, since I am doing that in my group?
Okay, I have to get out of the screens I'm in. Hold on. You should have a little button with an arrow, and it says share content. And if you hit that button, then you should come up with a little dialog box that shows you the screens and windows that you have open on your computer. And if you hit the windows or the screen, you can choose which screen you'd like to share. And then when you're done, you go back and hit the same arrow button and it'll say stop sharing.
Okay, thank you.
You're welcome. So for breakout rooms, it looks like there are a few people that I don't have assigned to anywhere yet. Lisa Nakotra is one. Alicia. And then we have a guest, Jessica, if she would like to go to a room.
Yeah, sorry, I don't know how to use my chat on the cell phone. Could I do food, medicine, and drink, please?
Yep, and who was talking?
Jessica.
Okay, thank you.
Okay,
Hi.
thank you.
I'll go to the food, drink, and medicine as well.
Okay, I'm sorry, I can't see my screen right now. Who's talking?
Lisa Nakotra, food, drink, and
Okay.
medicine. Thanks.
Okay. And then
hi,
just Alicia.
Can you put me in racism as a public health crisis?
Yeah. Okay, so for racism, I have Laura, Fatima, Anjali, Anna, Alicia. For food, I have Britt, Jerome, Andrew, Lisa, and Jessica. For environmental, I have Mary, Terry Ann, and Aaron. Margaret, what about you? Are you going anywhere?
Yeah, and I actually see Mary's hand up, so let's give her a chance to ask her question.
Mary, you just muted.
Sorry.
You Muted yourself.
Thank you for clarifying. Last week, I really wanted to be in the group that would be discussing, among other things, vaccine hesitancy. And for some reason, when I asked to go into environmental health and mental health, last time there was a robust discussion going on about vaccine hesitancy in that group. Thus my confusion. But I think I definitely belong in food, drink, and medicine.
Perfect.
Good. Thanks, Mary. All right, did we catch everybody? Everybody accounted for? Margaret, did you decide what you're doing?
Oh, I was initially going to go into food, drink, and medicine as well, just because that seemed to be a tiny little group. But I'm wondering which one is the smallest group now? Is that environmental and mental health?
Yeah, I believe so.
Yeah, so Jerome, do you still want to join food, drink, and medicine? Or are you going to stay in racism as a public health emergency?
No, I'm comfortable with food, drink, and medicine this meeting, and next working group, I can join another one. We'll see.
I'll go into environmental and mental health.
Great.
I have a question. Are you able to join over the phone? Or do you have to be in the Zoom?
Yeah, you have to be in the Teams meeting to get beamed to a different room.
Okay, well,
So
I'll
you
just
can-
wait till you all get done then.
And who's talking?
This is Sharon Horace from Ward 8.
What's the last four of your phone number?
6588.
I was going to try, but it's not available.
Okay.
Okay, so.
And Sharon, do you have access to a computer? Or, because I was going to say we could make sure that you have the meeting link to join.
Yes, I do. And I do have Teams, so hopefully I should be able to, because I was interested in the environmental and mental health group. So I will, because I had found all the information about the meeting online. So there is a link that way, or is it a different one?
No, I think it's the same link. Yeah.
Okay.
So if you can either go into the agenda, that was posted online, there should be a link in that document to get you onto the Teams meeting. Isn't that right, Hattie?
Yes.
Okay. I will do that then.
So when I beam everybody over, if for some reason you're not in the right group or you want to change groups, just come back to the main meeting room, and I can also shoot you somewhere else if you want to. And then how long are we going to be in our breakout rooms?
Well, we've got a little bit of new business, and we probably should just do a brief report out after we connect. So maybe 20 to 8. That gives us almost an hour?
Mm-hmm. That's what I would say, like 50, 55 minutes.
So we're coming back at 7:40, right?
Yep.
Yep.
Thanks, Hattie.
Okay, let me know when you're ready.
I
we
think
ready
we're
to go?
ready. Yes.
Okay.
Good.
We'll keep our fingers crossed.
Hi, Sharon. Looks like you made it in.
Yes.
Which breakout room would you like me to send you to? Hello? Looks like you're muted. Sharon, it looks like you're muted. I can't hear you. Hi, I'm still not hearing anyone.
Hello?
Hi, is this a guest with us?
I'm sorry, what was the question?
Terrible.
Sharon, I can't hear you if you're here.
I am. I actually had to update my Microsoft Teams.
Sounds like your phone is really close to your computer.
Yeah. Okay.
That's better. So which, did you have a breakout room that you'd like to go to?
I had wanted to go to the public health.
And sorry.
The environmental and mental health.
Environmental and mental health, okay.
Did other people do what we did?
What did you say, Britt?
I think everybody else did what we did, which was like leave the meeting altogether and then come back to try to rejoin the meeting.
I think it's just us, actually.
Oh, nice. Just the group of us? Way to go.
Hey, I think we're in the right place though, because I see Hattie's thing for resuming at 7:40.
Patty, are you there?
Yeah, I'm here. So did you guys get a message in your breakout room to come back?
Yes, I told them that you were yelling at us to leave by 7 to get back in here.
Patty, we did get the message, but there was no button to come back to the main room. So we left the meeting and then came back and then rejoined. And so you may need to send that advice out.
Maybe is it okay? I'll just end their meetings.
That's a good idea.
Yes.
You could have done that for us, Hattie. Jeez.
I was trying to let you guys like finish your thoughts, and not just jerk you out of the room, but I've never been in a breakout room, so I don't know what that looks like.
Oh, it's a magical
Magical, but also
place,
chaotic.
Hattie. Once you get into a breakout room, you'll never go back.
I can't wait.
I don't know. You got to go. Don't you have to go across through the eye of a needle or something?
I think we're all back. Is that right, Patty?
Looks like it. Looks good. All right. Oh, now I see a couple more coming in. Hattie, do we have everybody? Are you able to tell from our roll?
It appears to me that everybody's here.
Perfect. Well, why don't we do just a quick round robin from each of the groups, kind of just a small update on what you worked on and any next steps that you have. So maybe we can start with food, drink, and medicine, if somebody is willing to report out for that group.
Sure.
Mary, I saw you taking really good notes, and maybe Britt, I see you were about to talk as well. Oh, nice.
I'm just covert. Anywho, food, drink, medicine, we talked about the link between access, which includes feeling welcome into healthcare settings and wanting to go to healthcare settings. We see higher rates of emergency utilization versus primary preventative care in more underserved communities. So attacking misinformation, and Andrew, correct me if I'm wrong, please, but brought up the American Rescue Plan and some of the calls that he's had where there are various pots of money to apply for, to dole out for grants, and endorsing certain ideas like as this committee to help with traction. And then also looking at the messaging with employers about the cost of not supporting preventative measures like days off to get the vaccine and then the day after just in case it's needed. And also perhaps they're, really looking at the places that may not be following the letter and the spirit of the law for our guaranteed sick days in Minneapolis. And then we talked a lot about drugs, which was basically me ranting. But when we look at some of the issues that we're having in our communities with HIV, Hep C, and other high-risk infections and overdoses, the action item was I was going to try to touch base with people at Southside Harm Reduction as they had gotten a grant from the Bush Foundation to explore and study safe consumption sites and see how they could potentially translate to Minneapolis. And depending on where they're at with that, inviting them to present on that to this committee so we could offer support. And then following up on if the city in itself, Margaret, question for you, has there been any sort of stance on the legalization of cannabis?
I don't know that that's in my wheelhouse to answer, so I would have to take that question back to Gretchen and find out, what within the health department has been going on, or within the city, what kind of conversations have been going on. So I can definitely take that question back.
I hope it's not a surprise that everybody in our group is pro legalization of cannabis, not just the decriminalization, but also people on the medical cannabis program have way too many barriers at this point. But, when we're looking at harm reduction and alternatives and seeing that a lot of our issues with opioids and non-opioids are driven by prohibition policies. That's all right. That's what we got.
Great. Thanks, Britt. How about from environment and mental health?
Is that our group?
Yeah, I can take. Oh, go
yep.
ahead.
No, if you want to go for it, go for it.
No, Aaron, okay. I talked a lot in our group. You go right ahead, and if there's anything that is, it needs to get filled in, I can fill in.
All right. So our group talked about mental health the entire time, and the intersection of mental health and public safety. We touched on the lack of awareness in the community for where to seek treatment or crisis prevention, that type of thing. A lot of times, Sharon mentioned a lot of times that people will take children to adult facilities and vice versa. There's just a misunderstanding of what each facility or agency provides. Terry brought up, the licensing for mental health providers as a barrier to having better mental health services in our community. There's apparently a quirk in the legislation that the licensing scheme that says that only someone who is able to diagnose is able to provide mental health treatment. And Terry, correct me if I got that wrong, but I believe that was
yeah, to be a qualified mental health provider.
Yes. So
credentials. Mm-hmm.
So Terry is working on some proposed legislation with some of her colleagues, and we discussed the idea of the Public Health Advisory Committee supporting that via a letter or a recommendation to City Council. Obviously, a licensure change would have to occur at the state level, but having support from Minneapolis City Council or the Public Health Advisory Committee would be beneficial to their lobbying effort. So we touched on that. We also discussed the intersection of, again, public safety and public health, mental health. I thought it would be interesting, and Margaret and Terry agreed to actually have some data on what number of 911 or 311 calls are mental health crisis, just to kind of help frame the discussion. At a broad level in Minneapolis, we're talking about reimagining policing and public safety. Well, you kind of need data and some concrete proposals. You can't just do pie in the sky thing forever. So it would be helpful to get some data on how often are police responding to mental health crisis? What percentage is that? Is it 10%? Is it 33, 50? That type of thing. Getting some data from hospitals and things like that, so that we could take a look at it and kind of make a recommendation based on the numbers, because I'm not aware of, maybe someone else is, but I'm not aware of anyone doing this at the moment. and certainly, the discussion is to reframe public safety to include a component of mental health and addiction crisis, and perhaps PHAC could take a role of some kind in helping frame that discussion and fleshing out the details, because ultimately, if that's going to pass, somebody's got to do that. So we talked about that a little bit, and then I'm trying to think what else we talked about.
Well, and I would just add on, Aaron, I mean, even if that ballot amendment doesn't pass, right? Even if we don't change the basic infrastructure, that was the question I asked, like, what can we do? I mean, we're an advisory group, I get that, but what capacity do we have to shape a conversation and to elevate something, to say, we're not going to forget this just because this election is over, on the assumption if it doesn't pass. And if it does pass, how can we use that opportunity in the moment? Like, we're the Public Health Advisory Committee, and if a huge thing like this does pass, we should have some influence.
Yes, absolutely, and I totally agree. And getting that data, I think, would be a crucial step, and we're hoping that that's something PHAC would want to take up, because it's important to myself, it's important to Terry Ann, and something we're interested in.
Great. That's a great update. Thank you. Alicia is going to give an update from our group, Racism as a Public Health Emergency.
All right. Really lively, engaged conversation our group had today. We started really thinking about the idea of scope and measurability. As we all know, and as Aaron recently alluded to, the data does help to drive a lot of decision making, and evidence-based action plans really do help to strengthen change. When you're asking someone to do something new, they'll always say, well, why? And it's like, well, here's the data that supports this is why we should make this change. So that being said, we talked a lot, because we do have, people here, obviously, throughout the committee who are in practice right now, who are doing the things right now about what makes the most sense. And for us, it really came to, what scope is currently in place. Is there any scope or any measurability in place? And what is it that we can help guide? To that end, we've decided that our first step should be to reach out to Gretchen with essentially a list of, hello, this is our group. Here are the things that we've talked about previously. We're interested in if there are any data sets that the city has for public use, involving, race, ethnicity stratification, socioeconomic status stratification, anything on potential disease measurability that isn't COVID. We know that they're doing COVID dashboards right now. I've seen them on the city website. They're very updated. But if there's anything else public that we have access to, if there's anyone in particular that we should be talking to regarding scope, current, Minneapolis Health Department projects that are in progress or that are being queued up, and if there's anything that we can do as a committee to help either offer advice, perspective, or to truthfully act as a sounding board, because people who work sometimes in the administrative offices don't have the same perspective as people who are working, quote unquote, in the field, as some of us are. So that's our first big step. Group, I hope that was inclusive and covered what we discussed. Thank you.
All right. Well, thanks, everybody. I think that felt good to have some dedicated time. So hopefully that was satisfying for everybody to have a little bit of deep dive time and to get some next steps going. So I think, Margaret, you've got a couple new business items for us before we close.
Yes. So So we will be needing to think about a co-chair for this committee because Laura is going to step back as the co-chair, and then eventually as her term ends is going to actually step back from the committee, which creates an opening in that particular ward. I've been in contact with, and so has Laura, has been in contact with a council member. But I wanted to talk a little bit about that co-chair position. A number of years ago, PHAC made some decisions about having, kind of rotating co-chairs so that there was never a time when both co-chairs were, on the same term and left at the same time. So the idea kind of always has been that you serve for a while and then another co-chair comes in while you've got a current co-chair in place so that there's a little mentorship, and succession planning that goes on. So in this way, Laura's decision actually plays right into that idea of being able to rotate into a co-chair position. So, so my ask of you is, if you are interested in being a co-chair of this committee, all you need to do is really let me or Hattie or Jerome know that you would be interested. Then we would basically have, potentially if we had more than one person who stepped forward, then we would have some discussion about co-chairs at the next meeting and then take a vote to be able to, put somebody into place. So I just wanted to kind of put that tickler out there in your ear to think about it. You don't have to have a ton of experience. It's a well-supported position, within the committee structure. Probably the biggest thing is that the co-chairs and I meet about 2 weeks after this, our regularly scheduled committee meetings, just so that we can say, hey, what did you hear? What can we do next? What's the agenda? So we do have an agenda planning meeting that's about 45 minutes long in between the meetings, just so that we can kind of keep things on par. Laura, is there anything that you want to add about that co-chair position?
I think just that it's a great opportunity. I mean, I think I learned a lot more in the role, trying to understand speakers and more about the department. So I think that's great. And obviously it's fun to work and plan with Margaret and Jerome. So I'm bummed to step down, but I also am stepping down a little bit for my own personal wellness. I echo and feel some of Noya's similar feelings about the hall has been. So just loved the work and was grateful to meet everybody. So thanks.
Yeah, so anybody that's interested can just let us know via email, and would really appreciate your thoughtful consideration for filling that position, because it is a critical one. The other piece of business is that we have 2 candidates to fill Craig Hedberg's vacancy. When he leaves at the end of the year, it will be because he has served his maximum 3 consecutive terms. And he recruited 2 excellent candidates from the University of Minnesota, but it means that we have to choose between those 2 people. So I'm just looking for 2 or 3 folks that would be willing to do an interview with the candidates, and then we would make a recommendation to the committee. The committee doesn't actually have to approve that person, because it's really up to the university to say, yes, that's the person that is going to fill that, after we've had a chance to interview them and make a recommendation. So again, put that into your ear. Oh, Alicia, thank you. That would be fantastic. So I will get in contact with you, and then if anybody else is interested, just let me know, and we'll do a little doodle poll, get something together, and be able to do, just a brief interview with the two candidates. Craig has said either would be an excellent choice, and they just have different experiences, obviously, as any of us do.
Margaret, I'm willing to help with that if you need more people.
Great. Thank you, Erin.
Awesome. Well, I know we are technically 2 minutes over, so I want to be respectful of everybody's time. Thank you all for such a great meeting tonight, and have a good rest of your evening. Take care.
Yeah, take care, everybody.
Great
Thank
job.
you.
Everybody. Great conversations.
Good night.
Great job.
Bye.
Bye, Margaret. Bye, Hattie.